Good evening. Welcome to our webinar. Are you getting what you need from foods and supplements? Part 2 with our hosts, Zoe Phillips, Linda Sherlin, Caitlin Self, and Georgia Tetlow. I'd like to give you a more formal introduction about Georgia Tetlow. Dr. Tetlow founded PIM about 12 years ago, where we offer patient care as well as teach and train others to offer integrative medicine care. PIM's vision is to empower, inspire change, and create trust with patients, PIM providers and staff, the functional medical community, and ultimately the medical community at large. Dr. Tetlow maintains a patient care practice as well as a mentoring practice for clinicians in transition to or maintaining phases of integrative and functional medicine practice. She began mentoring healthcare providers in 2002 and has pioneered a self-care curriculum entitled Honor Self. And I give the floor to Dr. Tetlow.
Thank you so much, Nicole. I'm delighted to be here tonight. Thank you for that warm introduction. I know that you and the whole team has been working hard all day, and I really appreciate team members and also all of our attendees who are showing up this evening after all the things that they've had to attend to today, taking some time for yourself, for your growth, for your connection, and connecting with us, which is just where we want to be. I want to just share tonight, we have a few things that we're doing. If we can advance the slide, just to say, we'll be introducing a new team member to you tonight. So this is me, and you'll be meeting all the other team members, which you may be able to see soon. We'll introduce each other one at a time. But I have the privilege to introduce a new Philadelphia Integrative Medicine team member who you have not met before. We'll be showing a brief video of her and introducing her very personally. Linda and I have gotten to know her best of the team so far, and we'll be sharing with you our very warm welcome and our warm impressions and our delight at bringing her into our tribe and into our family. Something that we're doing tonight that's very important is we are acknowledging Zoe. Zoe will be moving away from Pennsylvania to North Carolina to be with her family, and we are really going to miss her. Zoe has given her heart and so much of her energy, and she has really dedicated herself to her patients, to the team, to the collaboration that she's offered, and she's really distinguished herself as a very experienced healthcare provider. And we are so delighted to have been part of joining with Zoe and providing patient care with Zoe. And we absolutely wish you the best in your future, Zoe. We care for you deeply. Thank you for being with us. So without further ado, I'd like to lead us in a brief meditation, and then I'll be introducing another team member, and you'll be getting to know us all a little bit more. But first things first, I'd like to invite you to take a moment to center and to come into your body and to come into your breathing, and just to bring your attention inside for a few moments, just to gather yourself. I find it helpful to place my feet on the floor. Take a few breaths. Relax my gaze. Relax my forehead, my eyes, my tongue, my belly. If you feel it would help you to center, just to lower your gaze or to close your eyes. Taking a moment to appreciate that you have arrived and that you are here tonight with us. Takes a lot to show up. That's really all that we ask. That's all that we ask of ourselves, is to bring our own presence. to bring our heart, to bring who we are in all of its textures and all of its facets. So you are most welcome here. It can be helpful too throughout the evening just to recenter on your breath, to come back into your body. And in the present moment is where we can receive, where we can communicate, where we can learn, where we can grow. So if there's anything tugging you into the past and your day and any worries you might have, just noticing that. And tonight, I invite you to come back to yourself and to come back to spend this time with us for your own learning and for your own nourishment. Taking a few more deep breaths and just noticing where you are tonight. And wherever that is, it's okay. You're safe. And we're together. So, wiggling toes and deepening your breath. It might feel good to maybe take a stretch and maybe make any gesture position change or any movement that would feel good for your body to come back in and to come back and finish our centering and to come back to the presentation and to another way of being together. So next slide, if you won't mind, Nicole. I'd like to introduce my co-pilot and my administrative partner, and someone who knows me very well, perhaps knows me better than she'd like to sometimes. I'd like to introduce my administrative lead, a very important member of the Philadelphia Integrative Medicine team. We have a wonderful team, a very full team, and tonight you'll be hearing from Linda. Linda is very accomplished as a healthcare provider and serves in a dual role at PIM. So she is very experienced, brings tremendous depth as a family nurse practitioner. She hails from Texas, and when she first moved to Philadelphia area to be part of PIM, she used to wear her Texas cowboy boots during the presentations. And, I look forward to the time very soon when you can see Linda presenting with her cowboy boots again. Linda has completed an integrative medicine fellowship, which is a real feather in her cap. So the Andrew Weil Center for Integrative Medicine offers a 2-year fellowship for practicing clinicians, and she completed that study in 2017. I just like to say that Linda and I have conducted a really extensive search for a new team member when we heard that Zoe would be joining her family in North Carolina. And we did our interviews together and our preparation together. And it was just easy and very clear each step of the way as we made our team whole again. So it was a pleasure to work with you on that project, Linda, and it's a pleasure to work with you on every project that we join together on. So I'd like to acknowledge you and just to say hello.
Thanks so much, Dr. Tetlow. I'd like to speak just a minute about integrative medicine. Welcome,
before
everyone.
You do that, Linda, can I interrupt you? We're just going to go and do Veronica first.
Sure, go ahead.
Okay. Oh, I'm sorry. We're not. That's my mistake. You go, Linda.
Okay, we're human here.
And forgive
it. Into our group tonight. Oh, yeah. So just a little bit about integrative medicine. If you're new to integrative medicine and the way we practice at Philadelphia Integrative Medicine is healing-oriented medicine, incorporates the whole person using all aspects of lifestyle, very reliant on a therapeutic relationship with your practitioner. It's informed by evidence. We have all the appropriate therapies. We bring the best of conventional medicine, functional medicine, so many things in all of our learnings to really bring you that full scope of care that puts you, our patients, in the center of what we're doing. We treat all forms of chronic illness. We use functional medicine testing in addition to conventional labs. We're very heavily telehealth right now with COVID. We feel like the safest thing for our patients and our practitioners is to use telehealth. Our patients in Pennsylvania are eligible for insurance reimbursement. We offer free consultations if you're considering and looking for the right fit. I'm going to talk about that a little bit more at the end. We also offer a newsletter, and we're going to talk about that a little bit more, how to receive our newsletter. And so now I think Dr. Tetlow is going to have a little introduction to Veronica, our new team member that, as she said, we are thrilled to bring on, as we sadly also say goodbye to Zoe. And thank you so much, Zoe, for all you brought to PIM, to our patients, to our team, to me. Very grateful for that.
There's no way to replace you, Zoe. So we are excited to introduce a new team member for Philadelphia Integrative Medicine. We are welcoming Veronica Porterfield. Veronica hails from Gainesville, Virginia, and she will be moving with her husband to the local area to be also closer to family that is local to us. So Veronica is a practitioner who's completed all of her training modules at the Institute for Functional Medicine. So she's completed her gastrointestinal and her detoxification and her cardiovascular and hormones modules. And she brings a long history of being a practitioner and a healing practitioner as someone who has completed training as a nutritionist in the 2000s and then has gone on to train as a physician assistant with her own patient panel. So Veronica has garnered her degrees from the University of Bridgeport for human nutrition, and then also from Shenandoah for her physician assistant's degree. So we're delighted to have her. She did her applying functional medicine training through the Institute for Functional Medicine as far back as 2017. And she really brings an emotional awareness and a sensitivity, an awareness of meeting people where they are in their healing journey. We're very excited in a few moments to share a video that she's provided us, just a minute and a half for you to hear directly from her tonight. So we hired Veronica for many, many reasons. Linda, I don't think we're going to be able to identify just a few. I personally am really happy with just how she balances a lot of details with just a real delightful human warmth and a real sense of personability and connection. And I feel very comfortable working with her. I also have really noticing it's a real mutual match. We're delighted to have found her. And I think she's also very happy to be joining our team. So without further ado, what I'd like to do is to stop the presentation, and from my own screen, I will share a video. We've gotten the sound as loud as we possibly can. And if you just give me a moment, I will pull that up. Okay, one screen is closed, so just give me a moment to find that. You can find all about Veronica on our website. This video is actually on our website, and Veronica's bio and a screenshot, like a headshot, is coming soon. But this is just a great sneak peek, and it's quite short, and I think it's really worth our time. Okay. So now I've found my screen. There we go. Thanks for your patience. So just a little bit of a technical difficulty here tonight. Let's see if I can.
Hi, my name is Veronica, and I'm from Warrenton, Virginia. I studied to become a PA so that I could help people to discover what their body needs to thrive. As far as what it means to me to be in this field, I believe that one of the greatest gifts and responsibilities that we have is the care of our own body. It is, after all, the vehicle that carries us through our lives, our relationships, our achievements, our experiences. So to me, it is a privilege to support patients in the sacred mission of caring for their own bodies by at times teaching, at times coaching, at times guiding, and always encouraging them. You might be surprised to know that I homeschooled my 2 kids for about a decade before returning to full-time work. 3 words that have been used to describe me are compassionate, curious, and dedicated. I was inspired to join this field by a healthcare provider who discovered that my daughter's eczema and constipation as a baby were due to a wheat allergy. So rather than treating those problems superficially, we were able to kind of get to the root cause of what was going on for both of those things. And I became a PA so that I could help my patients similarly. One piece of advice that I keep in mind is to remember that before anything, I'm treating a human, not a problem or a symptom. And as far as my legacy, I hope that my legacy will be an approach to healthcare that focuses on prevention, that demonstrates curiosity about patients and their symptoms, and that prioritizes patient education and empowerment. Thank you.
So please, if you'd like to see Veronica's bio again, it's on our website, and look for more information coming about Veronica. Now I'd like to introduce Caitlin Self. Caitlin is a functional and integrative nutritionist. She obtained her Master's of Human Nutrition from Maryland University of Integrative Health. She also sourced her education from Apex Functional Endocrinology and Mastering Functional Blood Chemistry, as well as the SIBO Academy training and GI Dietitians Roadmap and PCOS Nutrition Center. What I love most about Caitlin is her root cause mindset and her team-based approach. I love our morning provider meetings where we have opportunities to discuss patient care. And when patient questions arise, Caitlin just dives right in to offer key insights with a special emphasis on food. Her devotion to our patients is evident, and it's a privilege to serve patients alongside of her. Tonight, she'll be sharing about how sugar and FODMAP foods can feed the wrong bacteria, and about how pairing nutrients can help increase absorption. Caitlin.
Thank you so much, Linda. Hello, everyone. Welcome. Happy to have you here. I'm going to take a moment to introduce our host this evening. So today's going to be a little bit more of a round table almost. We're going to be bouncing around. All the practitioners are going to be participating. So it'll be a little bit more interactive. But our host is going to be Zoe Phillips. Zoe is the PA here, who I have been very, very lucky to learn from and shadow over the last several months since I started at PIM earlier this year. She's trained in functional medicine with 2 separate programs. So she is trained through the Institute for Functional Medicine, as well as the School of Applied Functional Medicine, and is the only provider here who is duly certified in functional medicine. We are excited for her to share some more insights with us tonight, and we're all excited for her new upcoming adventure. So Zoe, why don't you go ahead and take it away?
Excellent. Thank you so much, Caitlin. I so appreciate that warm welcome. So without further ado, let's kick it off. Is this you? Are you someone that is dealing with heartburn, abdominal pain? Maybe you have some occasional gas or belching after meals. Maybe you feel nauseous from time to time, maybe especially in the morning. Are you someone that feels bloated? Do you have to unbutton your pants at the end of the day? Are you noticing more diarrhea or noticing that you're not having regular bowel movements every single day? If you are, know that you're not alone, and we're curious. Tell us more. What is your body experiencing? So we're going to conduct a poll. Feel free to choose the answer that resonates most with you. We have several options here: heartburn, abdominal pain, gas or belching, constipation or diarrhea, bloating or nausea, or maybe none. So take a moment and please vote. All right. Is everyone able to access the poll?
Mhm. And we have 94% participation, Zoe.
Excellent. All right, so let's take a peek. Now that this poll is over, it looks like the majority of you are struggling with gas and or belching. And in, let's see, a tie is bloating. So thank you so much for your participation. It's good to know that this presentation will resonate with you. So stick around, because this is absolutely going to give you a little bit of insight as to what may be causing some of those GI symptoms. Okay, and on tonight's agenda, we will be talking a little bit more about what we chatted about in the first presentation, which was all about digestion. So if you wouldn't mind advancing to our agenda slide, please. All right, we're going to start off by talking a little bit about Digestion 101, just going through that. And we're going to spend some time talking about absorption, which mostly occurs in the small intestine, learning a little bit about the large intestine as well. And we're also going to talk about what can go wrong in relation to absorption. That could include damage, such as with celiac disease, H. pylori, antibiotics, and medication. We could also experience leaky gut, aka enhanced intestinal permeability, as well as various types of dysbiosis like SIBO and parasites, Candida, and overgrowth of good and bad bacteria. And most importantly, we're going to be covering the things that we can do about it, the steps that we can take even immediately to start feeling better, things that will cover lifestyle interventions, certainly testing, and various interventions. So let's spend a moment and revisit digestion. First, we think about digestion as often starting with maybe chewing, but actually that's not the case. The first aspect of digestion is that cephalic phase, and our brain is very much involved. The thought, the sight, the smell of food, that's actually what starts the production of saliva and stomach acid. And of course, next we have the mouth and chewing our food nice and well about 20 to 30 times ideally helps to signal for our stomach to produce that very important stomach acid, which then further helps to break down food and helps with nutrient absorption. And that chyme, that digested food, will then enter the small, followed by the large intestine. And this is where brush border enzymes are made, bile and pancreatic enzymes are introduced, and where the majority of nutrients are absorbed. So tonight we're going to be focusing on the two main areas, the small intestine and the large intestine. We're going to revisit the stages of digestion, which starts with the cephalic phase with the brain, continues on to the gastric phase in the mouth and the stomach, and ends with the intestinal phase, where we'll be covering the small and the large intestine. So next, we'll be discussing the small and the large intestine, where the magic happens, the majority of absorption. And Caitlin's going to share a little bit about this slide.
So I think that this is a really helpful slide because, as you can see, we have the esophagus leading down into the stomach, then the duodenum through the ileum the duodenum, the jejunum, and the ileum are actually parts of the small intestine. So I use this slide all the time with various clients and patients, depending on what's going on. Many people assume that we're doing a lot of absorption in the stomach, but actually the majority of the absorption of nutrients is happening in the small intestine, which is why when we see issues with the small intestine, such as SIBO or fungal overgrowth, or even with celiac, we see a lot of nutritional deficiencies because there's damage to this section where most of our nutrients are absorbed. The large intestine comes after this, and the majority of things that are absorbed there are primarily just water and electrolytes, a few other things as well, but those are the main things. So here's where you're really going to see the majority of our absorption happen. Any type of resection of the gut, any type of like a gastric bypass or any type of GI surgery or inflammation in the small intestine is going to impact what we're actually able to get from our food. When we look at a SIBO test and we see where the overgrowth is, gives us a little bit of insight as to what nutrients we may need some additional assistance with while we're working on managing SIBO. So as you can see here, most of the nutrients, micronutrients and macronutrients are listed out here. And this is their first stop after the stomach, where most things are being picked up by the body. Thanks, Zoe.
Thank you so much, Caitlin. I love staring at that slide, and it's like something to enlarge and put on many walls in my home and in the office. It's just fascinating to understand where things go in and how they go in. We'll make a transition here and we'll talk about instances. Zoe mentioned a few and we'll go through them systematically where things can, quote, go wrong. I just want to comment that Caitlin was mentioning that it's kind of important for the body to have each step, each phase for digestion to occur. And sometimes if part of our intestine has been resected, for example, with some type of gastric surgery, that we sometimes will have to adapt and compensate. And that's also one of the reasons why we're here, to partner with patients and to help to ease and compensate and also make our bodies work as optimally as possible, regardless of what can go wrong. So that's why we're here, and that's why we partner with you. So we're about to talk about some things that can be a little bit scary, especially if you fit into the category that we're talking about. So we want to provide some reassurance and also say that our role is really to partner and to start with just where we are. So one of the things that can go wrong in terms of damage to the intestine is when we develop an autoimmune illness, for example, celiac disease. Celiac is a response to gluten, and it's a combination of our genetic makeup, our lifestyle, and the experiences that have accumulated and have led up to that moment in time, and also a trigger. In this case, the trigger for celiac disease is gluten. Gluten is not bad, but in this case, it's actually just the straw that changed the experience of the camel. So it's the straw that broke the camel's back, which led to this new physiological state where we're actually attacking ourselves. Gluten is actually the trigger that will cause our own autoimmune response to blunt this very high surface area, the villi, which are these outpouchings of the intestine, which increase the surface area and the absorption for us. These villi are actually blunted or destroyed. In some cases, there can be a significant repair after this type of damage. But this is the increased surface area where we're going to absorb many, many nutrients, which you can see from that previous slide, including a lot of vitamins, a lot of minerals, a lot of macro and micronutrients, and certainly B12. Here's just a slide to go on to our next item that can go wrong, quote unquote. H. pylori, here's a poll for you. We'd like to know if you think that H. pylori overgrowth, that's a parasite that lives in the stomach, is this most often due to A, contaminated food and water, B, low stomach acid, C, person-to-person contact? We've got a really quick group and a lot of responses coming in quickly. So we've already got 50%, 66% responding. Great group tonight. You're there, and we're so glad. Mhm. So we'll just see if anyone has a final answer, and then we'll end the poll and share the results with you. So thank you so much. Our poll is here. Let me know if you can see the results. I believe we're sharing the results, and the results as I can see them, a majority or 64% of you feel that low stomach acid is responsible for H. pylori, most often responsible for H. pylori overgrowth. And then the second popular answer is contaminated food and water. And the final answer with a few respondents is person-to-person contact. Okay. So let's go back to our presentation and talk a little bit about this. So H. pylori, I have a few things to share, and then Zoe's going to add a few comments. H. pylori is actually not just a bad bacteria. Like many organisms that live in us and on us, H. pylori is actually a natural and welcome bacteria that is not harmful when it's in the appropriate quantity. And in fact, what we're noticing is that there's a tremendous drive to eradicate H. pylori, which is actually causing imbalances. So we don't want to eradicate this parasite in the stomach. We actually, even though it's a parasite and we think of parasites as bad or H. pylori as bad, they're not bad. H. pylori is just harmful and out of balance when it's in overgrowth. So H. pylori is actually a parasite that lives in the stomach, and it will thrive when there is a low stomach acid. And so that's the answer to our question. So it's most often a result of insufficient stomach acid and a pH that's not at the level that nature intended. So the stomach is intended to be at a very low acidic pH where nutrients can be broken down and prepared for the next stages of digestion. And when stomach acid is low, H. pylori can overgrow. As it overgrows, it further works to suppress hydrochloric acid or the stomach acid inside us. And that will help to maintain that overgrowth state. So when H. pylori is shutting down all those natural acid pumps so that we can digest our food, it's allowing itself to maintain itself because it prefers that altered, imbalanced pH. When you have low stomach acid, it leads to other problems. So when your stomach acid is not sufficient, the later stages of digestion, the bile, the elastase from the pancreas, and actually many other enzymes that are inside the intestine that need to be at a certain pH to function properly and to break down nutrients for absorption, these processes don't work as well. We don't adequately break down our food, not just because we don't have stomach acid, but because the later stages of the digestion, including the role of the liver, the role of the pancreas, the role of the intestine itself to digest food, are not as optimal. And you can see that scary picture on your screen to the left of this parasite entering into the cell, which can be crossing through the mucus layer of the stomach and securing itself. Zoe, what would you like to share about H. pylori?
What I find positively exciting is that there are many alternative ways to address an H. pylori overgrowth. In conventional medicine, we think about the triple antibiotic therapy, which is often coupled with a proton pump inhibitor, as most people who are seeking help from conventional medicine actually experience a stomach ulcer due to an H. pylori overgrowth. In an integrative and a functional approach, we can use a combination of therapies such as supplements and even foods that can help our patients to address H. pylori. But the most important aspect in addressing an H. pylori overgrowth is to explore the why. Why is that H. pylori overgrown in the first place? And as you so correctly answered in the poll, the answer is, for most people, low stomach acid. And that begs the question again, why? Why is there low stomach acid? And this is something that we spend lots of time working through with our patients to understand their specific reasons for low stomach acid, whether that's how they eat, when they eat, anxiety, stress, previous trauma, hypothyroidism. There are many more explanations for low stomach acid, but the important piece that we do is to partner with our patients and find their unique root cause. Your cause for H. pylori overgrowth may be completely different from someone else, and that's okay. That's why we spend the time getting to know you and your story to really parse this out to make sure we're addressing this once and for all, and that we don't need to revisit H. pylori overgrowth in the future.
Thank you, Zoe. And thank you for just also speaking to our approach, which is so personalized. And that's also what you've modeled so beautifully. So our next slide is another thing that can go wrong, which is actually just advancing the slide to talking about antibiotics. Antibiotics, like everything, has its time and place. So antibiotics, there might be something that you might have taken recently or more remotely. Sometimes we might even be one of your practitioners that might find a time and place for the prescription for antibiotics. So prescriptions of pharmaceuticals aren't bad, gluten's not bad, H. pylori is not bad. These are things that certainly have their time and place and that can be really helpful, especially when they're understood fully and how they affect us. So antibiotics, as we know, are going to affect the microbial balance. And then when they infect bacteria and they're antibacterial, they can also be promoting other types of microbiota in our gut. For example, promoting yeast overgrowth or making a niche for other types of organisms, for example, parasites and other things like that. So our role is to also work to mitigate if there's a treatment that you've undergone or if it's part of your comprehensive program to get you to your goals. For example, an antimicrobial program, if you're balancing your gut, or if you're recovering from a condition that requires antibiotics, part of our job is to help you to mitigate any consequences from medical treatment. We're helping you heal after different experiences that you might have had in the medical profession in terms of your level of trust, your level of feeling safe, feeling heard with your medical provider. We want to reestablish trust in our patients, and we care a lot about our relationships with those who see us. And we're also helping to repair the damage that can be actual physical, not just emotional or spiritual or moral injury that our patients have experienced. So Caitlin's going to talk a little bit about some of the things that you can do to mitigate imbalance that can sometimes come from antibiotic use.
Thanks, Georgia. So the best thing that we can do when it comes to recovering from antibiotic use or preventing damage from any antibiotics is to provide additional friends for the microbiome in the form of probiotics. You can get this as a supplement, or you can take this in the form of food, things like sauerkraut, kombucha, kimchi, fruit kvass, and even yogurt can be very beneficial in making sure that there are no additional overgrowth patterns or dysbiosis that occurs from the antibiotics. Ideally, you would be increasing these things during the time when you're taking those antibiotics to support the ecosystem of the microbiome. But, you know, some of us grew up with a lot of exposure to antibiotics and we didn't know as much about the probiotics that we wanted to use. And as a result, you may not have been able to prevent any damage, and now you need to recover from it. So working with a provider is very important here, but really starting with food and really getting a wide variety of colorful fruits and vegetables, which we'll talk about a little bit later, as well as other plant-based foods that are rich in fiber and phytonutrients, which are the colors that you see in different plant-based foods, can give the actual fuel that the other species in the microbiome really need in order to grow and thrive. So we start with making sure they're our friends, and we make sure all the friends and all the locals have food in the form of fiber and different colorful phytonutrients. All right, back to you, Georgia.
I have had many experiences. Sometimes healthcare providers will actually choose us as their partner in healthcare. And I can remember an example on multiple occasions when a doctor or a nurse or someone who's working in the healthcare profession, there's a particular doctor and nurse that I have in mind right now, who would come into the clinic and say, yeah, I've been on a proton pump inhibitor and acid reducing medication for more than 10 years, more than 20 years. And that's just part of my program. That's just something that I'm taking. For example, they were told that they had a chronic condition or a condition that really required, like Barrett's esophagus, something to reduce stomach acid for safety. And they're just living with a state where their pH has been altered, their acid has been blocked. There's over-the-counter and prescription medicines that are so prevalent that when I was doing my medical training, my conventional training for internship and residency in the 2000s, the routine called GI prophylaxis was to put absolutely 100% of people who came into the hospital immediately, without even asking any questions, on a proton pump inhibitor every single day that they were in the hospital. So we're very comfortable with providing acid blocking medications in our medical culture. We don't see any issues with it. In fact, when we sometimes don't know what to do, or we have a GI complaint and we're not sure what step to take, and we feel as a practitioner we need to do something, a conventional provider will often just put on an acid reducing medication as an action because they feel a little bit uncomfortable and not quite sure what to do. So the prevalence of these medications is profound. They have affected so many things about our world and our earth, and also the pH of the animals and the humans, because of the decades that we've just overused these medicines. And again, there's a time and a place for everything, and these medicines can be very helpful. And sometimes we will be prescribing, for example, in the short term in a focused way as part of a comprehensive plan. So these medications are designed in different ways to lower our stomach acid. And when we do that in a chronic way without sort of paying attention, and then we just continue to take these medicines, what we're doing is we're inhibiting our ability to absorb key nutrients. And that will have long-term effects on our bony skeleton, our ability to absorb minerals and magnesium. And there's a tremendous number of nutrient depletions that occur when we stay on acid-reducing medication. So if you find yourself on an acid-reducing medication, it's not a great idea to just stop it all at once. The opportunity is to taper. And that's because if you're suppressing your stomach acid, you're actually building up the precursor to stomach acid. So if you stop right away, it's like letting the dam go, and then you have a little bit of an acid bath, but it's not because you have high acid, it's because you've been suppressing the precursor, and then the precursor just expressed itself to such a high degree. So the key is to partner and to do the process slowly, and also understand all of the different integrative approaches that we have. There's different supplement and lifestyle approaches that we have to help the body get back into a natural state with an appropriate pH in the stomach. And that's actually a reason that people will come and see us in the clinic or part of their program. So I'd like to transition to our next concept of something that can go off. Many of you who've been in the clinic who have had a comprehensive diagnostic stool study will have heard us talk about particular markers that will tell you if you have intestinal or increased intestinal permeability. So permeability is good, but when we have overpermeability, it can lead to issues. So again, everything in its time and place. So you can see this picture to our left. This is an example of why the gut is so responsive to changes, for example, to drugs or to chemotherapies or to stress. Our gut lining is actually a single layer of cells. It's just a single, thin, fragile, vulnerable layer of cells. And these cells are kept together by these tight junctions. So they're supposed to be tightly adhered to each other. It's a thin boundary. It's quite thin, but it's extremely important and it's very meaningful. So when that thin layer of epithelial cells is damaged and there's actually breakage between cells and leakage, we call that increased intestinal permeability or leaky gut. And those little green particles could be undigested food. They could be microorganisms. They could be toxins. And these items can pass through across this broken barrier, and they can go into our bloodstream, which can be extremely confusing for our immune system because we don't know if this is an undigested pear or piece of celery or if it's a pathogen. So when these foods or bacteria or toxins get into our bloodstream, it basically will increase inflammation and also create a lot of work for our immune system, which is trying to discern self from other. Digested food is self, and partially digested food or things that leak through into us is not self. And it just causes a lot of immune reactivity, which can lead to other problems downstream. So large food molecules can pass through the intestinal cells, and that's what they're supposed to do, is go through the cell barrier. But when they go between the cells, that's where we can have this real derangement of this very delicate structure. And it's very easy to develop nutrient deficiencies and problems absorbing food or absorbing whatever you put in your mouth when you have intestinal permeability, because there's so many other actions and activities going on when you really just want to have a quiet, non-inflamed intestinal barrier for absorption. We'll make a transition, and there's another section we want to talk about, which is dysbiosis. And Linda, would you like to help us understand this further?
Absolutely. Thank you, Georgia. So the first type of dysbiosis, so when I think of dysbiosis, so, you know, it's a breakdown in our bacteria. It can be overgrowth, it can be undergrowth. So too much of a good thing, not enough of a good thing. Also, opportunistic bacteria can come in. So we're going to talk about that for a few minutes. So when we think about the slide that we saw earlier, where we've got the stomach, then the small intestine, then the large intestine. So we're going to talk first about the small intestine and SIBO, or small intestinal bacterial overgrowth. And so this is when the problem is in the small intestine. Those of you that had bloating, there can be other reasons, but often we do see bloating is very common with SIBO. So the small intestine should be very acidic to prevent bacteria from growing. And bacteria, and then the bacteria and the food as it moves through from the small intestine to the large intestine, there's a valve called an ileocecal valve. If that valve is not functioning properly and does not close, some of that bacteria from the large intestine can kind of leak back up or creep back up into the large intestine. And I describe this, it's like kind of like the bacteria have then gone to the chocolate bar in Vegas or something. And here is all this food that they love to eat, but they're in the wrong place. They should be down in the large intestine where we just got the fiber, which is what they need to eat. And so they're kind of like a kid in the candy store, which can cause the bloating and the distension, because when those bacteria digest the food that they're eating, they can create hydrogen gas, methane gas, hydrogen sulfide gas, and therefore they're eating the food and prevents absorption. Something we think about is maybe iron deficiency anemia, wondering, could there be some SIBO going on so that you're not absorbing your iron? The next type of dysbiosis that we want to talk about are parasites. Often we can get parasites through water. Maybe you might, if produce is not well washed, salads, eating at a salad bar, you can pick them up out of the ground. And those are parasites. They feed on nutrients from the food that comes into our gut. And again, it causes us to prevent absorption of nutrients. It can also lower the immune response in our gut so that our gut is not as strong. And the next type of dysbiosis that we want to talk about is Candida, or fungus, or yeast. Now, if the yeast backs up into the small intestine, then we call that, instead of SIBO, small intestinal bacterial overgrowth, we would call it SIFO, or small intestinal fungal overgrowth. So yeast loves sugar, yeast loves the dark. Think about bread rising. When you put yeast and you're making sourdough or making some kind of bread, and it just grows and grows and grows. And so that's what's happening in our gut, if you will. It takes up a lot of space. It takes the room for beneficial bacteria. It takes nutrients from beneficial bacteria. It takes nutrients from being absorbed. And so again, all of this dysbiosis can create nutritional deficiencies. Hence, we don't feel good. Often with Candida, people might be experiencing skin rashes, other things. You know, it may not just be that bloating. Often we see symptoms that occur throughout the body that are linked back to the gut. Gram-negative bacteria like Klebsiella and Pseudomonas, they're not native in the GI tract. And so normally if we have our nice healthy microbiome, they're kind of like, I call the Klebsiella and the Pseudomonas like the party guests. They show up to the party and sometimes they can be just fine and they're kind of quiet and they mingle and everything, but then they can get a little out of hand. And when they do, you know, they kind of open another bottle of wine, a few more cocktails, and before you know it, there's a fight somewhere and the lamps are falling over. And so that's what happens. Our healthy microbiome is kind of the bouncer that keeps these under control. So if this Pseudomonas, if the Klebsiella, if these things overgrow, they produce a toxin called LPS. It's cell damaging, and it can damage the lining of the gut and cause leaky gut, and also, again, prevent nutrients from being absorbed. I think you may be seeing a trend here that all of this dysbiosis can be that we just can't absorb our nutrition. And so we wonder, why do we have these nutrient deficiencies? And again, and you'll see it, Pim, a lot of times when you come in, the first thing we're going to do is we're going to say, what's going on with the gut? Because this is often the root. The other thing is we want to think about is once we begin to repair this and find a balance in the gut where we can absorb our nutrients, we can begin to have that healing that we so desire on our healing journey. So Zoe, we're going to turn it back over to you.
Thanks, Linda. You know, it can feel a little daunting to discuss what can go wrong, especially if some of these things resonate with you. But we want to put you back in the driver's seat and now discuss what we can do about it, which includes lifestyle pieces, testing, and interventions. So Linda, back to you. We're going to talk a little bit about lifestyle.
When it comes to lifestyle and stress management, I'm kind of the one, not that we don't always talk about it, but maybe I'm one of the people that talk a lot about what can we do to improve our lifestyle. And I like to think of, you know, we think about stress management. And when I think about that, I'm like trying to keep a grip on the stress. You know, how do I keep a grip? And what I've really come to believe and what I've learned is maybe we can work on building our resilience. Maybe, you know, you can't stop the baby crying and waking up in the middle of the night. Maybe we can't even change our job. So that stress is going to be there, and that causes a sympathetic nervous system activation. And so that's our fight, flight, or freeze activation. When we're in this state, we don't make our optimal stomach acid. And so, you know, that's when like your stomach feels all tight and you're trying to eat and the food just won't go down. Well, the reason is because that mechanism is there to protect us. We think of that sympathetic nervous response as needing to run from a tiger. Well, you can't be chowing down on food and running from the tiger. We've really got to be in a space to make the stomach acid, to make our saliva. And so what we want to do is we want to be sitting down, not standing up eating in the kitchen. We want to be sitting down. I always think about maybe have a nice place setting, you know, a placemat, even if you're only a family of one, you know, just a nice plate and silverware, you know, is kind of a nice thing to make it a special event. Eating should be special because that's where we come into our parasympathetic nervous system, which is our rest and digest nervous system. Because stress, it can be mental, it could be emotional or spiritual. So, you know, if you're watching the TV and the news is on while you're eating, you're running from the tiger again. What's going on in the world? Or maybe you're kind of having a little chat about the bills and that's not going so well. So what we want to think about when we sit down to eat is really looking at our food. Caitlin's going to talk about those phytonutrients more in colorful food, but looking at our food and smelling our food and taking some breaths. We're going to talk in just a minute about a way to breathe, to begin to prepare to receive your food and to be in the place where you can absolutely digest. So deep breathing, meditating, it can just be short breaths right at the beginning of that meal, and that puts us in that sympathetic state. So I want to show you something that we can do. It's called a 4 square breath. It's really simple, and I'm going to kind of talk you through it, but maybe you want to join with me. And I want you to kind of notice where you're at now. Maybe you're relaxed and maybe you're listening really well, but I'd like for you to sit back and kind of like we started in our meditation, just put your feet on the chair, and it's gonna come in 4 sections of 4. So let's think about inhaling, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4, and inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4. And just take a minute and notice. What do you notice going on in your body? What are you feeling? This is where we want to be when we sit down to eat. We want to just be relaxed. We want our minds to be relaxed and very present and focused right in the moment. Now I'd like to turn this back to Zoe, and Zoe's going to tell us a little bit more about some testing that we can do to evaluate.
Excellent, Linda. And I just love that 4 square breath. I know that can be a great tool that can quickly lower cortisol, that adrenal hormone that skyrockets when we're stressed. So thank you so much. In addition to lifestyle pieces, we can get nerdy. We can dive into testing and see what's really going on a more esoteric level. So ways to go about this include a stool test. We utilize the GI map, which looks at the gut microbiome, good bacteria, bad bacteria, parasites, worms, leaky gut, inflammation, H. pylori overgrowth. We really appreciate how comprehensive it is. And certainly this could be helpful if we're looking for or suspect barriers to your absorption. Of course, we offer a SIBO test as well to help us understand if you have SIBO and more importantly, what type, because there are different ways that we approach SIBO, whether it's methane or hydrogen sulfide. We also have nutrient tests, the Genova NutriVal or the SpectraCell micronutrient test, which can give us an idea about your micronutrient levels. And this applies to absorption because if absorption is impaired, then we often see very low levels of nutrients, and that tends to be a pattern. And that can also help to guide our supplementation as well, our supplementation recommendations. And we also use labs, and labs are a great way for us to check on some key vitamin and mineral markers like vitamin D, zinc, copper, magnesium. And so this is a great and often affordable way for us to assess some key nutrient markers for our patients. Next, we're going to talk a little bit about interventions. And this can include an array of topics. We can start off with visceral manipulation, diet, supplements, and sometimes when necessary, medications. What I'd like to talk about first is a poll to assess and learn a little bit more about SIBO and what your thoughts are about how this can best be treated. So a poll for you today. True or false, there is not much that can be done to prevent SIBO. The most important aspect is treating the bacterial overgrowth in the small intestine. Is this true or false? What do you think? Okay. Excellent. Thank you so much for your participation. And let's check in here if most of you are done voting. Okay. I think now is a good time to end this poll. And you guys are a smart bunch. Everyone said false at 100%. I love that. So let's explore some of the things that we can do to prevent SIBO. We obviously know that there are, number one, there's a reason for an overgrowth of bacteria in your small intestine. And for that reason, there is, of course, things that we can do in order to prevent it. One thing that I love to talk about with our SIBO patients is visceral manipulation. We partner with visceral massage physical therapists who are certified in this practice to assess different valves in the GI tract. This is really key for SIBO patients in particular, because we often find that those with SIBO have dysfunctional GI valves. These valves can include the pyloric sphincter, which separates the stomach from the small intestine, the cardiac sphincter, the sphincter of Oddi, the ileocecal valve. That's a super key valve which separates the small intestine from the large intestine. And we love partnering with other team members who can really give us some key insight. What I love is that physical therapists can assess these valves without any special type of tool. They can just use their hand. So it's non-invasive and can give us incredible information and can really help our patients to achieve resolution of their SIBO. And I've found that for the majority of our patients with persistent SIBO, that this tends to be one of the major roadblocks for their healing. So this is why one of the key things we like to suggest for our patients before we get started on any sort of SIBO treatment is visceral manipulation and having that assessment, which can be a really incredible experience. We can proceed to the next slide, please. This is a chart of the different causes of SIBO. So as you all answered correctly, there are certainly ways that we can prevent SIBO and definitely root causes to explore. Now, visceral massage is absolutely key if the visceral causes are the root cause, but there can be more. A physical evaluation is important to see to what extent your valves are functional, and that's carried out by a physical therapist. But there are other considerations, such as medications that can affect your motility, adhesions after surgery, food poisoning, even traumatic brain injury, and a lot more, as you can see from this excellent handout. This is actually something that we use and share and discuss with our patients to, again, help them find their unique root causes of small intestinal bacterial overgrowth. And again, this is so key because it's not enough just to treat SIBO. As we know, patients who are treated with SIBO without addressing the root cause, they tend to have high reoccurrence rates. And that's not okay with us. We want our patients to be addressed once and for all and to move forward knowing that their gut is well balanced. So this is a key part of what we do, is getting to know our patients and helping to explore what is your specific root cause of SIBO.
So handing it over to you, Caitlin.
Okay, so we're going to talk about some interventions for general gut health. We covered a few of these or some similar versions of these in the first webinar, so feel free to go check out part 1 if you feel like there are any gaps that you're not sure what we're talking about. So the first thing we're going to talk about is diet. Now, I'd like to clarify 2 things about diet. We have our standard diet that we consume on a regular basis, and then we also have a therapeutic diet. That is a dietary intervention that is meant to be short-term and is meant to really help with a specific condition. So a diagnosis of SIBO, SIFO, Candida, dysbiosis, an autoimmune disease. These are things that are therapeutic, and they are meant to help reduce symptoms and sometimes provide specific nutrients in order to help with the healing process. Your regular daily diet is really meant to be more of a balanced diet that is not restrictive, that has a wide variety of foods from every food group. So you'll see here, sometimes we have elimination diet, a low FODMAP diet, a low sulfur diet. And the biggest mistake that I see people make is doing their own research. They say, oh, I have gas and bloating. They do some research. What can I do for that? And they find the low FODMAP diet. And then they come to us after they've been on the low FODMAP diet for 2 years or 3 years. And really, the low FODMAP diet is low in fermentable fibers to help with the symptoms of SIBO, symptoms in the small intestine, but yet it may not have enough of those fermentable fibers for the large intestine. So sometimes we'll do SIBO testing, GI map, and we'll find that not only is there a SIBO overgrowth present, but there's dysbiosis in the large intestine that may have happened over time as a result of just not feeding the bacteria in the colon. Because sometimes when SIBO goes untreated, and we can get that dysbiosis as well. So I just think it's important to know that really when we're doing any of these therapeutic diets, whether you're recommended by a GI doc or you find it online, it's typically expected to be a short-term intervention. Whereas more of a whole foods diet is what we tend to recommend as a long-term sort of maintenance recommendation. And then one thing that we did also just want to briefly mention here is that your diet really makes a difference with the healing process, making sure you're getting the different nutrients in, but also, as we've talked about with absorption, certain nutrients pair better together. So for example, fat-soluble vitamins A, D, E, and K have enhanced absorption, about 75% better absorption when they're consumed alongside fat. And then I like to talk about iron. Iron deficiency anemia is the #1 deficiency, the micronutrient deficiency worldwide. So we know that that's very common. It happens with GI issues, with SIBO, with celiac, with low stomach acid. And if you're consuming plant-based iron, so thinking of any, even something from a cast iron skillet, or getting iron from beans or greens or broccoli, vitamin C enhances iron absorption. So making sure that you have a little bit of vitamin C alongside that, having lemon with your plant-based meal, other forms of vitamin C, lots of fruits, raw bell peppers, raw broccoli, strawberries, citrus fruits can be really helpful there. So we like to look at the full picture and see what's going on. But with iron, it's not just about that initial absorption. There are many other nutrients that are present in the process of taking that iron and either storing it or utilizing it. So we need things like vitamin A, copper, and zinc in order to actually get that iron where it needs to be so that we have energy and all of our blood work comes back normal. So lots of different little tweaks can happen here, and some of them may be very short term, while others may be recommendations longer term, most of the time. We're also going to touch briefly here on supplements. So on the next slide here, we have digestive enzymes listed, and basically, digestive enzymes are coming from a few different places. We have pancreatic enzymes, which come from the pancreas. So when we have pancreatic issues, pancreatitis, diabetes, we will often have a decrease in available enzymes to break down our food. So we can take this supplementally. Digestive enzymes are things you can take. Some of them are activated in an acidic environment, while others are activated in a basic environment, which is alkaline. So if you're activated in an acidic environment, that's the enzyme you need, but you don't have enough stomach acid, then even taking that digestive enzyme supplement may not actually be that helpful. So some combination is required: digestive enzymes, stomach acid support. We also have brush border enzymes, which are further along the GI tract. We see huge issues with brush border enzyme production in cases like celiac disease, as well as some other autoimmune conditions and that sort of increased intestinal permeability or leaky gut that we talked about before. That's a little bit trickier to figure out. You really want to see what's really going on, like with a stool test or with any diagnoses, to see if brush border enzymes are also necessary to help with the breakdown and absorption of different nutrients. I also like to point out that in addition to digestive enzymes, bitters can be helpful here. Bitters function not in the exact same way as enzymes, Many bitters also contain enzymes. So there are some enzymes that are found in plants that can help with the breakdown of different molecules, especially protein. So you may have heard of enzymes in papaya or in pineapple. Those are the most common ones that we'll use. So you can get sort of a vegetarian-based enzyme or a tincture or bitter or something that contains those enzymes. Those are also available to you. But again, we don't just necessarily want to be taking these things willy-nilly. It's very helpful to do some testing, work with a provider. The GI map can give us some more information on whether these digestive enzymes are necessary. A lot of times what I'll see if individuals do try to play around with it themselves is that they will feel better for the first 2, maybe 4 weeks, but eventually the benefits will fade because the enzyme is not the root of the problem usually. Perhaps if there is a pancreatic issue, yes, that may be part of the root, but typically there's a lot more going on and you may also need support throughout the rest of the digestive tract. And then lastly, under interventions, we're just going to touch on medications. We are an integrative practice, which means that we use all of the available resources that are safe and effective for our patients. And even though we mentioned how antibiotics can cause some issues, we know that they can be life-saving medications that can really help to improve the quality of life and can also really just make a difference with your general condition and progressing so that you can kind of reach more balance long term. So when they're necessary, we may use certain antibiotics such as Xifaxan and neomycin in the treatment of SIBO. Another reason why we test, we don't guess, we like to test first so we know exactly which of those antibiotics is going to be useful. We don't always need them. There are a lot of antimicrobials that we can use instead. So you may have heard of berberine or oil of oregano or biocidin. These are herbs that are sort of like nature's antibiotics. They're really, really effective. In many cases, they're equally or more effective than some of these broad spectrum antibiotics. So sometimes we'll use those. And then what we like to do is help the patients get off of medications that are not going to benefit them long term. So for example, PPIs and H2 blockers are ones that lower stomach acid, and except for some of those situations that Dr. Tetlow mentioned previously, like Barrett's esophagus, we really want to try and wean off of these medications because medications do have harmful effects sometimes. And so if, it's always weighing out the pros and cons. And if we can find an alternative, safer, just as equally effective or more effective way to help you stop picking up your prescription and, heal your body so you don't need to take those capsules every day, we always love to do that. I think most of us tend to be happy when we don't have to take a lot of medications every day. And it just gives us some peace of mind that we can rely on ourselves and our bodies and let the body really, truly heal. Okay, so those are the main things on interventions, unless anyone else wanted to jump in and throw any other ideas in there. Otherwise, I'll kick it back to Zoe.
Excellent. Thank you so much. So we encourage you the next time you experience that GI distress, remember your body is speaking with you, and symptoms are our body's way of communicating with us to share with us that something's not quite right. It doesn't mean that we're broken. It doesn't mean that there's something wrong with us. It just means our body is trying to talk with us. So that way we can seek healing. So we encourage you, think about some of the lifestyle interventions we discussed tonight, such as stress management, such as utilizing eating hygiene before meals, or even that 4 square breath. And most importantly, think about considering with an integrative medicine provider so that way we can partner with you in your journey. This journey is about you. And that's why we really enjoy getting to know our patients as unique individuals with their own life stories, their own biochemical makeup. What we want to do is serve you in the way that works best for your body. And that really involves spending time getting to know who you are and what makes you you. So thank you so much for joining us. Please do not stray. We have more to discuss tonight, and we encourage you to ask questions. So at this time, we would love for you to utilize that Q&A tab at the bottom of the Zoom screen and type in any remaining questions you might have about the webinar tonight. We've covered lots of topics, and we'd love to continue to explain and answer any additional questions you might have. So please continue to utilize the Q&A tab and type in your questions. We are going to proceed and share just a couple announcements, but do tune in because we will be answering your questions at the very end of this webinar.
Thanks so much, Zoe. What a fantastic presentation, everyone. I hope that you have all enjoyed listening as much as we've enjoyed bringing it to you. Another way that we love to serve our community, and I mentioned this early on at the beginning of the presentation, is through a free 20-minute consultation. If you've kind of been thinking, wow, that sounds like me, man, my body must really be talking to me. I wonder about this, but I'm not sure if this integrative medicine thing is a fit for me. Please reach out. Right here is at our PIM free consults, or you can just go to philly-im.com and there's a getting started tab and you just choose schedule an appointment and go in and choose a 20-minute consult. This is 20 minutes for you to begin to tell us what's going on with you, for us to ask a few questions and decide if Philadelphia Integrative Medicine in particular is a fit for you. As we had said, we have Veronica coming in. She's going to have a lot of space to talk with you and time to be meeting you in these 20-minute consults. So we would love to meet you and talk to you in this way and see if this is a good fit. We have a resources page on our website. We're also on Instagram and Facebook. We would love for you to go on and like us. It's a great way to follow along with what's going on at PIM.
Okay, and for those of you who have ever visited my website, you know that I love a deal and I am very frugal. And so we're excited to share that we do have a coupon. So this will arrive in your email tomorrow. For anyone who has registered for this, you will receive this as part of your registration. You get 10% off any appointment type. So it's only for those of you who registered. It'll be emailed to you by 5 p.m. tomorrow. And it's valid for any appointments that you schedule from October 5th, which is today, through October 11th. So the appointment doesn't need to occur during that time, but it's just that's the scheduling window to utilize the coupon. So there's some more details there, one per customer, and we can combine it with anything else, but you do get 10% off of the next appointment that you schedule. So make sure between now and the 11th, you get that taken care of.
Mm-hmm. Thank you, Caitlin. And we know that a lot of people that are listening tonight are also, there's lots of folks listening, but also some of them are participating by getting that special code in the email that comes tomorrow. So open that on up. I want to just mention that we're starting to see some questions come in, and feel free to put those in the Q&A section down below so we can help you with those. And this is a time for you to be reflecting and seeing what ways you'd like to interact with us. So please start verbalizing, sharing those questions in the question and answer tab. This is just to say that we are a leader for healthcare provider health and wellness, not just patient and general public health and wellness. And we've been a leader in this area for a long, long time. So we support healthcare providers and integrated professionals, and we do that in many ways. One of them is Nicole and I were leading our 75th monthly healthcare workers and integrative professionals group this last Monday. So this is a free and widely available group. We have people from all over the country and all over the world. Sometimes people are hailing in from Hong Kong, and we gather together in a confidential setting, and we seek to reteach a thing its loveliness, which means to spend some time during a self-care experience, to have time to reflect, to hone our skills, to also remember what's important, and some of the elements like emotional health, healthy boundaries, healthy mindset, and understanding some of the building blocks and the upstream practices that can help to make us be our best so that we can offer our best in our work. Our next session is November 1st. It's 8 to 9:30. in the morning. And often people will sign up for that. And then if you're a healthcare provider, integrated professional, you can get the recording of the meditation. So if you're not available at that time, please register and receive that gift. So our next slide is just to say we try to offer value and connection through our networking events. So the self-care group this once a month is actually for self-care, but this event, our provider lunch, is literally for official bona fide networking. It's to support professionals who are seeking community and seeking ways to grow their practice. And we want to support every member of our community. We collaborate. We don't feel there's any need for competition, for us to support each other as integrated professionals, to understand each other's needs, and to also meet each other where we are and to share. So we'd like to support you, and we'd love to invite you as an integrative professional to our providers lunch, 12 to 1 on Friday, November 12th. Please register at the events tab. So just go onto the website, choose the events, and you can easily register there. Another way that you can connect with us is through our newsletter. And we seek to give you the tools to be well. So we have a lot of things to offer. Our blog is put together by Alexa, and there's multiple ways that we're contributing to this newsletter. And there's really interesting topics. I love opening up the newsletter, and I'll write a portion of it and I see what other team members are contributing. It helps you keep a track of what events are taking place. And these are freely offered to the community to empower you and show you your role in your own health. And we would love you to subscribe if you're not already on it, or to resubscribe, because we will be presenting our next webinar on January 11th. So you can mark your calendar. It's a Tuesday. It's going to be 7:30 to 9. January 11th, we'll be presenting and letting you know that topic soon enough. Another date to remember is that Veronica Porterfield, our new physician assistant, will be seeing patients as early November, just a couple of weeks' time. So in about a month's time, she will be accepting her own new patients, and she's looking forward to seeing anyone in a free consult. So you can also just get started with her. And we're looking forward to that. Thank you. Let's transition over to Q&A. It looks like we're accumulating some questions, and we'd love to interact with you.
So I see here that Amber has a question. Can pelvic floor dysfunction cause SIBO or IMO? And, you know, as Zoe spent quite a bit of time talking about the benefits of visceral manipulation, visceral massage, part of that physical therapy consult, and what happens is assessing the pelvic floor function. And so all of this can contribute. It may or may not be a cause, things like adhesions, things that are going to be found in that physical therapy appointment will help to determine how this is contributing to SIBO or IMO.
Mm-hmm. And IMO stands for intestinal methanogen overgrowth. It's a much more specific term because it's taken a long time for the medical profession to actually begin to understand and further study and interact and acknowledge that SIBO exists. And intestinal methanogen overgrowth is a little bit more of a precise description of certainly methanogen referring to methane type SIBO.
Looks like we have another excellent question from Amber. Is SIBO cured or just managed? SIBO can be 100% resolved. And this is something that we can confirm not just by symptoms, but also by a SIBO breath test, which can be super helpful to pinpoint the type of SIBO and of course the amount, the parts per million. So this is something that patients can absolutely move forward from, but unfortunately with different approaches, SIBO tends to be more recurrent. And we know that to be true when this root causes have not been fully addressed. This is why we spend so much time exploring potential root causes before we even make a recommendation for SIBO treatment. We want our patients' SIBO treatment to be effective and to be as short as possible. Several rounds may be necessary, but we really want to make sure that our patients do not have to utilize any additional rounds that are not needed. We want to save their their time and their money and their stress. Going through this journey can be just that, a journey, and we want to make it easier for them. So that way we, really hope to explore those root causes with them upfront.
I was so happy when, as a team, we developed, and this really came right from the provider team, a SIBO root cause checklist, which is a form that you can complete, and it's even before your appointment starts. So there can be an understanding and an acknowledgement of some of these root causes, and looking at past history, past surgeries, brain injury. There's so many, this is a long litany and list of things that can contribute. And that came directly from the collaboration of our provider team. I'm just so happy that we have that tool, and we can give that to you to fill out even before your appointment starts. Thank you, team. Got some more questions here, and we're delighted to have those. Which one should we go to next?
I can answer this question about constipation. We have another one that says, what is a natural way to treat constipation? I think it's great to be thinking about this naturally, because constipation, again, is one of these signs that there's something imbalanced in the body. So typically, the first starting point is making sure you're getting enough water, making sure you're getting enough hydration. Hydration includes water and electrolytes. So making sure that you have those electrolyte minerals. The second is going to be fiber. So making sure that you're getting enough fiber. The recommendation is 25 grams of fiber per day. Most people benefit from more than that. So somewhere in the range of 35 to 60 grams per day of fiber. Historically, we probably had close to 90 grams of fiber per day. Digestive tracts may not be robust enough to handle quite that amount of fiber right now, but increasing your fiber is the second thing. I recommend doing water and hydration first, because if you increase fiber first, it can actually worsen constipation. So starting with the water and then moving into fiber. Fiber coming from fruits, vegetables, beans and grains if tolerated, and fiber supplements if needed. From there, you want, if you're not seeing any progress, any success, that's definitely when I recommend, okay, let's see what else is going on. Do we need to do a GI map? Do we need to do a SIBO test? Do we just want to take a general look at the diet and see, are we consuming allergenic foods possibly? Are there a lot of processed foods that are known to cause some blockages? Is there a lactose intolerance present? Is there not enough fat in the diet? That's a common one that people forget about. Fat actually helps to lubricate the entire digestive tract. So if we're not getting enough fat in, we can experience constipation. And are we eating enough food? This is one that I see all the time, especially with adolescents, or very busy, adults as well. If we're not eating enough food, we do not have the bulk that is necessary to help with migrating motor complex and peristalsis, which is the muscular movement through the large intestine. So yes, there are definitely natural ways to treat it, but here we're always going to try to look for the root cause, and that's what we would recommend. Anybody else?
I love that answer. And I would add to that to take a look at our previous webinar when we talked a little bit about magnesium, that natural calcium channel blocker that relaxes all the muscles in the body, including the GI tract. And for so many individuals, a magnesium deficiency is actually quite common and can easily be addressed. Of course, we want to partner with a provider so that way the recommendations are safe and effective for you. There are many different types and all have different purposes, but that could be a great tool to utilize as well.
So I see there's a question about how do I increase, or how does one increase low stomach acid? And I think that's a great question. One of the things we want to be careful to do is not to just fix things. Oh, I've got low stomach acid. How do I make that better? How do I make that go away? As Zoe mentioned many times, and as you can hear from every answer and every slide that we're presenting, we're not trying to make a symptom stop. We're inquiring, we're turning towards, and we're being curious. Oh, what's happening? What is my body communicating? What is going on? And sometimes when we want to sort of kill the messenger, or we want to make it stop, or we want to fix things, we can really miss what is the driver, and also what is the message and what is the communication that's coming through. So Sometimes it can be as simple as lifestyle choices. And if we're not doing some of our recommendations that Linda shared earlier in the presentation about how we approach ourselves and some of the stress management techniques, or actually breathing before we sit down to eat, or how we present our food to ourselves. Literally, lifestyle choices can make a huge difference to how much stomach acid is present at the time of the meal. But it really runs the gamut between lifestyle choices all the way to supplementing and replacing stomach acid, and all the tests that you can do in between to see whether or not you actually have low stomach. Is that really the issue? Is it a low pH? And also, some of our testing can detect if there is a pH imbalance in your stool. That's a little bit downstream. But I think that question is a great one to bring to an integrative interaction, which is, why is my stomach acid low? It's not just how does one change it and increase it as an academic question. And that's a real personal exploration. And also, we want you to do everything you can to help yourself. And then if you run into any barriers, we're here for you.
I see another question here about the hydration and electrolytes. The question is it essential to get sodium each day, and how much, if, for example, you aren't really using much salt and are supplementing iodine? Sodium is actually an essential mineral. We think of the Western diet as having too much sodium simply because we use salt as a preservative in our processed foods. So I would say, yes, you definitely want to be getting salt in. And if you go with sea salt or Celtic gray salt or Himalayan salt or even a Hawaiian salt, you're going to be getting sodium as well as some of the other minerals that are present there.
Mm-hmm. Thank you for your acknowledgements. You're talking about the way that we're interacting as a team. Thank you, Jen. And we collaborate like this every day. It's not just for these presentations. We're doing a lot of tag teaming and supporting each other. There's a question about prokinetics for slow motility from SIBO. That's an important question. And we want to be aware, just like Caitlin was mentioning, food is a prokinetic. So there's herbals that are acting as prokinetics. We often think of ginger and artichoke acting on the intestinal, the organs, and actually the secretory organs to actually help promote the migratory motor complex, which is promoting the peristalsis and the movement of food through the intestines. Prokinetics are one of the factors and things, the part of the SIBO comprehensive plan. If we have actually a plan, we're looking at root causes, and also some of those treatments are absolutely key. So we use prokinetics all the time. We use different types of supplements. We probably have 4 different types of prokinetics that we can choose from very commonly. And we also want to be aware we're not just fixing the problem. We're really looking upstream, as was mentioned. So we could do a whole presentation on prokinetics. That was just a little taste. I hope that was enough for you, Amber. You had wonderful questions tonight. Thank you for interacting with us, and we hope that was helpful for you. Maureen, thank you for interacting with us tonight. I see that you have a question about COVID boosters and J&J. This is not a presentation all about COVID and boosters, but we also recognize that a vaccine is a very effective way to prevent COVID. It is the most effective way to prevent COVID. And we do encourage our patients to get COVID boosters, and to also inquire with their healthcare provider, with us, and with their healthcare team, whether or not they have questions about whether or not a vaccine is right for them. That can be a private conversation, and we respect everyone's choice. But we also encourage our patients to consider a COVID booster when they're eligible and when it's available. J&J vaccine, we do know that you want to consider a COVID booster if you've gotten a single shot J&J vaccine, simply because of efficacy rates for prevention for COVID. I hope that's been helpful. And let's see if there's any other questions for us to address tonight. Is there anything else that a team member would like to mention about addressing any questions that have come through?
I think we're about at the end of our time, Georgia.
We're done.
It's kind of flown by.
It's flown by. Thank you so much for spending your evening with us. We respect you. We respect how you would like to proceed with your body, with your health care. Our job is to partner with you, to listen to you, to honor you, to give you the space to do things your way. And many people will come to us because they have very strong feelings about how they would like to be interacted with how they would like to proceed with and have their values reflected in their healthcare. So we care, we listen, we're here to support you, and every treatment plan is unique. And we appreciate you coming and learning more about us if there's an interest for you to continue to partner with us and perhaps learn about us for the first time in a free consult. Thank you so much to my team, and thank you to Nicole. Thank you, Zoe. We're looking forward to further acknowledging you and this special time that we have with you as you're finishing your time here. Thank you, Linda. Thank you, Caitlin, for everything you've given tonight. And have a wonderful evening. Take care.